I'm Chuck Ehrlich. I'm here today to talk about vitamins, minerals, and supplements. I really think food is the most important thing, and that eating properly is one of the most important things you can do for your health, and that you can't correct that with vitamins, minerals, and supplements. It's got to be a balance between the two. So I do have a disclosure. I am the publisher of the Nutrition Guide. So nutrition is an essential part of care or self-care for both of these conditions. And the place that the vitamins, minerals, and supplements can really be beneficial is in providing things that you are not able to get from food. And we'll highlight a couple of things as we go through this, because there are some things that people are not able to metabolize from food or not able to find in food sources. And some of the supplements provide nutrients and concentrations that you won't find in any feasible quantity of a food that you might want to actually eat. And we're talking about all the related conditions because so many people have mixes of these conditions. And I think the two Karen's article, the Karen Herbst and Karen Beltran article, really summarizes this, that there's so much overlap between EDS hypermobility type and lipedema that lipedema is both a fat disorder and a form of lymphedema. And then we have Dercum's disease and we have obesity that can be overlaid on all of these. And these all share features in that people with these conditions are likely to have gut dysbiosis. They're likely to have gut dysregulation. Particularly in the EDS hypermobility type, there are also likely to be structural issues in the gut and the digestive tract. And this is an area that we don't know a whole lot about at this point, but other people with EDS hypermobility type who may be normal weight do have a lot of GI issues. They have a much higher incidence of many GI conditions, including something like 8 times the normal rate of celiac disease and high rates of ulcerative colitis and Crohn's disease and other gut conditions. And then, of course, the lymphatic system is impacted by all of this and is key to maintaining so many of the health conditions. And is key to the inflammation and clearing the inflammation. When the lymphatic system isn't working, the inflammation is prolonged. And we'll talk tomorrow about how food choices can affect that. So these conditions are also different. In particular, collagen is different. In the collagen and connective tissue, in EDS hypermobility type, it's weaker. You have greater skin elasticity. In the Dercums, you have, as Karen was explaining earlier, you have an increase in this inactive collagen. And we don't really know nutritionally how this all ties together, but that's a key factor in this. It's also interesting that resting energy expenditure, the basal metabolism, is lower in lipedema and not in Dercums. So this is a lot of interesting things, a lot of things that we can learn and get corrected in this. So we've summarized things looking at the different supplements and organizing them based on the type of evidence that we have. And we've organized them into 4 groups. The first group is those that you can test for, that the tests will show that there are abnormal levels, and the test that can show that if you're getting adequate supplementation. So these are your B vitamins, the B12, the vitamin D, calcium, and DHEA. And the deficiencies in these areas are very common in both lipedema and Dercums. Particularly the B vitamins, because the B vitamin absorption depends on the gut function, and anybody who has any sort of gluten sensitivity is likely to have impaired absorption of B vitamins. So this is what we recommend here, that there are different forms, and you can test to see how your B vitamin levels are. There is a caution on here, which in some people, the B12 supplements will cause acne. This is just one of the anomalies of what happens with this. Vitamin D and calcium. Vitamin D deficiencies are very common and will impair a number of functions. They'll impair healing, it will impair other functions, and will interact with drug absorption. So you want to consider 2,000 to 4,000 IU a day on that, along with calcium. And this is one that's easy to test for, and should be monitoring that. DHEA is a supplement that we have found that you can assess the levels, particularly older people, both men and women, may need supplements for this. It can help to help preserve health and maintain health. The group 2 are the ones that you can't easily test for. We suspect that there are abnormalities are common. We show that there are benefits from supplementation. So multivitamins, this is insurance. You want to be sure that you're getting the basics to prevent deficiencies, things that are in trace elements in particular that may or may not be showing up in your foods. Magnesium is very important. It has many functions. It will help with a number of the symptoms of lipedema and Dercums, and many people, particularly women, are not getting adequate magnesium, and the supplemental magnesium will help with the pain, and soaking the feet in Epsom salt, because the magnesium is absorbed from the skin, provides several benefits, because not only does it provide the supplemental magnesium, it helps prevent infections of the feet. And so that may be the best way to get that. Selenium, we do have some research that shows that supplemental selenium does help in lipedema, reducing pain and swelling, even though there may not be a clear sign of deficiency. This is the one where you do have to be careful, because it's easy to have too much selenium from a supplement or from Brazil nuts, and too much can be harmful. So we recommend that you limit it. You either do a supplement or you eat Brazil nuts. And if you're eating the Brazil nuts, then there's a limit on the number that you have per day. If you're shelling them yourself, you only get 3 a day. You got all the extra effort of shelling them. If you're buying them already shelled, then you get 6 per day. And omega-3 fats help in several ways, because it helps with cardiac function. It helps with the circulation and the fatty tissues, and helping to keep you more comfortable overall. And we have the guidelines here of either getting it from a supplement or routinely eating fatty fish or other sources. And you want a mix of the different types of omega-3s. So there is the EPA and DHEA that are in certain supplements and are in fish, and there's the ALA that is in the primarily found in the nuts and seeds, and it's good to have both of those. Now, Inulin fiber is a specific type of fiber. It's found in foods. It's sometimes used as a food additive. It's not, but there's also a lot of fibers that you can buy if you look at fiber supplements, and most of the fiber supplements that will be on sale are not inulin and are not particularly going to do you any good necessarily from the standpoint that we're concerned with here. And the reason we like inulin is that it is the favorite food of some of the healthy gut bacteria that help form the short-chain fatty acids and the neurotransmitters that are key to so many bodily functions. And so if you're not able to get enough inulin from fruits and vegetables, you can consider supplementation, and the supplements are available. It can be a powder, it can be a chewable gummy, and you don't want to overdo this. If you overdo this, you'll get diarrhea, but it's not harmful. There's no danger in it. But it's also particularly helpful if you're on antibiotics. You want to increase your inulin fiber because it will help to maintain or restore the healthy gut bacteria. L-Arginine is a very interesting one. This is one of the cases where people may need supplementation because healthy people are able to synthesize arginine. When they're not able to synthesize enough arginine, they're able to metabolize it from food sources. But if you're not that healthy, you have fatty liver disease, you may not be able to do either of those, and so you may benefit from a supplement form of this, and you may get fairly dramatic benefit. So you need to look at the instructions on this. Consider the L-citrulline, which is converted in the kidneys, to provide a longer acting, because otherwise it's a very fast acting supplement. It's cleared through the system quickly. But it does help with lymphatic function, it does help with lipedema, and it has been proven to be useful. Then we have another group of compounds that are clinically beneficial. These are not so much things that you would eat in foods, with the exception of the bromelain in pineapple, but they have shown some benefit. Particularly the flavonoids. Some of these come from food plants, some of these come from non-food plants. I grew up with a horse chestnut tree, and we're always told, don't eat the horse chestnuts, they're poisonous. They're not good for you. There's two forms, there are multiple kinds of chestnuts. There's chestnuts that are safe to eat and horse chestnuts that are not good to eat. So the flavonoids and bioflavonoids can be beneficial. You get flavonoids naturally in citrus fruit and other fruits that contain them, but you may get a more highly concentrated or more controlled form in some of the supplements. And there has been some research showing that particularly butcher's broom is beneficial in supplement form. Butcher's broom is a flower. It's not something you would eat. Diosmin is another flavonoid. It's available in multiple forms as a supplement. This is also available as vascularia. And these are the forms of this. So this has shown some benefit in helping to stimulate the lymphatic system. So clinical experience, it's useful. You may want to try rotating these, not taking them consistently, not trying them at different times, at different doses to see. And we'll get back, it gives you some guidelines on that in a second. But also be careful, check about interactions before you start any of these. Curcumin or turmeric has a long history of being beneficial and helping to stimulate function, helping in many ways. You do want to check with your healthcare provider if you have conditions that it can affect or you're on medications that it can affect. There is a lot of research showing that this is beneficial. There is also a recent article that got a lot of press that led people to think that maybe curcumin was not beneficial. This article was actually about drugs that are based on the active ingredients of curcumin that are not being successful, but the curcumin itself has been showing benefits and has a lot of research showing that it's beneficial. Start this on a low dose, see if it works for you, and again, check for interactions. So here we have butcher's broom. It's a flowering plant, and this is one particularly where in some of Dr. Herbst's research, he's shown good results with this in combination with selenium, and it's able to help with lipedema and with lymphedema. Now here's the tongue twister. This is a mushroom extract from traditional Chinese medicine that some people find useful. Mycelium glandulosa lucidium, that has an anti-inflammatory effect and helps as a fat reduction. And some people have found this beneficial for both lymphedema and lipedema. And calcium-D-Glucarate can help correct some of the imbalance in the gut. It gets a little bit complicated. The microbes in the gut actually have a number of functions. One of them is regulating estrogen levels and other things. And if you're not routinely getting enough calcium-glucarate, if you're not actually routinely getting enough glucoric acid from food sources, supplemental calcium-D-Glucarate can help to correct that. Although we really would like you to get it from food sources and to help you maintain the healthy bacteria in the gut. And systemic enzymes have a long history for helping to heal the gut, helping to restore bodily function, helping to help with a number of different functions, particularly recovering from injury or any kind of insult. These are something that you want to take occasionally. You want to take them between meals. They're not a digestive enzyme, and you would either take a systemic enzyme or bromelain, but not both at the same time. Pineapple has a long history of being recommended as helpful for lymphedema. There's actually very little research to support that, but it does have an anti-inflammatory effect. If you want to get the benefits from it from fresh pineapple, if you want to get the benefits from pineapple, it needs to be fresh pineapple, not canned, and you need to basically eat it between meals so the enzyme can do its job without competing with other digestive enzymes. Or you can take it in supplement form. You would not want to do both. And it can affect particularly the supplement can interact with certain antibiotics or blood clotting. So you need to check with your healthcare providers about that. And then there's a group of what are called lymphatic stimulants that are helpful for the lymphatic system. And we have found, my co-authors who practice, and I say we because I'm not a practitioner, I'm the researcher and the writer of the nutrition book, have found some of these to be valuable. Some of them we have overlapped with ones that we have discussed before, but many of these are combinations. And some find these combinations are beneficial. You should take them as directed and see how they work for you. Now the general guidelines are again, they can be beneficial. This is guidance based on what my colleagues who practice have found and my colleagues who have these conditions have found. They have overlapping effects. You want to be careful about what you take. You want to keep records of what you take. You want to think about taking them intermittently so that you're not always taking the same things. And you want to again, like everything else, consult with your healthcare provider. The doses we give are average doses. Doses may need to be adjusted based on your size. Include them all in your medication list, and look for brand names and established seals that show that they're made following good manufacturing practices, because there is no effective regulation of supplements There is just all sorts of stuff on the market, and you really want some assertion that it is safe, that has been following the GMP practices, and that you have an adequate assessment of what the active ingredients are, and you need to look at the quantities carefully on the labels. And there's more information on this in our book. This is where you can reach me. I'm Chuck at Lymph Notes. I've been running the website for many years.